Well, Mario Ottiglio is a global health policy analyst and he's joining us from Geneva. Mario, good to have you with us on the show. It's nice to see you again. So, Europe once again at the epicenter. Take us through what makes this winter different to the last.
Good morning. Thank you for having me. Unfortunately, from the numbers, the situation seems to be quite similar, and things have come back to where we left basically last winter. Although clearly we are dealing with a different type of realities right now, where we have a lot of vaccinated people in a lot of many parts of Europe. And so we are starting, let's say, from a base where there is overall more immunity and there is overall more conscience. I have to say the spike are kind of unavoidable. The two main drivers are clearly the cold season and, which of course down overall immunity, but is also a kind of enticing people into staying a little bit more in contact, more in close spaces, and also one of the let's say data that is being pointed out by experts is the low vaccination coverage in several parts in Europe. Clearly, the virus itself continues to spread because of the Delta variant. But also we have, a combination of factors, right? Yes, there is the low vaccination rate, but there is also that mitigation strategies that have been relaxed. People try to kind of stay away from social distancing. They want to come back to the previous life, to the pre-pandemic life. And there is also a little bit of fatigue because, yes, there is the need to resume business, to resume societal duties. There is some sort of tiredness from the lack of policy coherence that we're witnessing. I think it's difficult to predict, right, how many of those ways we will be. The solutions lay in a combination of factors when it comes to, of course, increasing the vaccination rate, but also trying to work on those who cannot or don't want be vaccinated and really resume some of the interesting and effective measures that we had before around testing, around promoting innovative solutions. We don't want to run the risk that we continue this kind of like waves like this, because we need to also to think that there is a lot of people in the world that actually not even have access to the first dose, and therefore there has to be also some sort of like check-in point at international level of where are we at globally with this.
Yeah, Mario, let's just stay focused on Europe for now and the case count. Are we clear that the case count that we've seen rising in a number of countries is corresponding with the number of deaths that we're seeing in those countries? Are they at similar levels as they were, in the summer and at last winter?
Yeah, so from the numbers, of course, there is a big difference between countries where the vaccination rate is higher. We see, for instance, that countries like Italy, Spain, or Portugal, those that really have been quite effective in terms of vaccination strategy, the impact, right, of the virus is definitely less severe. The concern is really in countries like in Romania, in Bulgaria, where the numbers are particularly challenging when it comes to the number of deaths. So there seems to be a correlation there in terms of the vaccination rate, definitely.
Okay, Mario Ottiglio, could keep talking all day, but we have to leave it there, unfortunately. Global health policy analyst. Thank you very much for being with us.